Hello and welcome. This is Deepak Mishra once again, and I have come up with this new videos to answer the questions which have been asked in last few weeks. I did not find enough time to answer these questions as and when they appeared, but I have been going through those questions, and I thought with the end of 2017 it's only prudent that I answer those questions and give some perspective to the candidates who have asked these questions. First of all, I'll take questions will be in the order from the way they were asked from 3 weeks. Some questions are 3 weeks old. Ali M writes, thank you for your information and tips. I'm a new graduate 2016 and almost done with internship. He has already done his A1, A2, B1 and planning to finish B2 in a couple of months. His question is that, do I go to Germany? Once I go to Germany, I do experience in hospital along with medical Deutsch course or start looking for a job. He's a bit confused about what comes first, Berufserlaubnis or approbation. See, Ali, I would say Berufserlaubnis comes first, approbation comes later. For both these, you have to take the exam. For Berufserlaubnis, you have to take Fachsprachprüfung, and for approbation, you have to take Kenntnisprüfung. Your question was like, once you come to, you're coming to Germany for a medical German course, and your question is, should you get experience in hospital along with that? Yes, if you find time, if you find your course, depending upon your course schedule, the course duration, if you find time and if you find an opportunity in a hospital to do an experience, it's always recommended, it's always better, because during that hospitation, during that observership, you learn the system, you learn to how the system works, whom you should call, whom you should, what is the procedure for patient management. So that is always recommended, that if you get a hands-on experience before actually beginning a job. And that also helps you with, as I have mentioned in my previous videos about these exams, Fachsprachprüfung and Kenntnisprüfung. If you have first-hand experience in a hospital in Germany, it helps you a big deal. It helps you a lot compared to the courses which you attend. So, because there you see actual patients, you are not allowed to do things, but you see actual patients, you see other doctors manage patients. So that is obviously recommended. And start looking for job, that you have to do side by side all the time. Once you reach Germany, once you have B2 certificate, you have to start looking for a job. And looking for a job is sending emails, so that you have to do side by side. So it's not either or, it's like simultaneously both. So next is Lovepreet Singh. He writes, what if somebody did internship from foreign country like China but didn't clear MCI? Can he apply for PGC? Lovepreet Singh, I would say, as I have mentioned in all my videos, that also my previous video, that you need to be a doctor. You have done your internship, fine. Do you have a license to practice either in China or in India? If the answer is yes, if you have a license, then you can apply. If you don't have a license, then the way is very tedious, which I have discussed in my previous video, this FMG without medical registration. You can go through that once again. You have gone through that, I see that, but you go through that once again and you will find the way for you. Next is Danielle Moodley. Hello, I did my MBBS and I would like to do my internship in Germany. Is this possible? Depending upon where you did your MBBS, internship is possible. If you did from EU country or you are a EU citizen, then you can definitely do your internship in Germany. But if not, obviously after completing the language skills, because without language you will not be able to work in German hospital or do an internship in German hospital. Your question is very unspecific, Danielle. You'll have to be more specific, which country, where, what, and all those things. Then the Monkey Experience writes, can I come and work in India after residency and working for a few years in Germany? Monkey Experience, you can, right now it's not clear about the recognition of a German Facharzt in India. The MCI website does not very clearly mention. They mentioned about some recognition of some places, but then they talk about East Germany and West Germany, and things are not clear. I think they have not updated the website in last 2.5 decades. So, and even if you ask MCI, they do not give you a clear answer. They say that whatever is written on the website is valid, but you'll have to clear that from the MCI. In next few years, that might change. That is just my guess, because since This is so because so far a lot of Indian doctors did not come to Germany because Germany never accepted anybody outside of EU to be a doctor in Germany. But since last 4-5 years, the rules have changed and now they're accepting. So once the batch of people who have come here last couple of years, when they finish their FACATs and they start applying to MCI to get recognition, then it might change, because so far nobody has applied. That's why nobody has got. That is my personal guess. I cannot say anything officially on that. Rockstar writes, does 11th and 12th percentage matter for studying MBBS in Germany? Definitely, if you have a good CV, good academic records, you will be a preferred candidate. But I would say once again that since Germany does not recognize your education comparable to German education, they will test you on their own grounds. They will test you on their own standards. You will have to take those tests to get into Studienkollege. Then you have to clear that test for Studienkollege to get into medical university. So your 11th and 12th percentage will not be that of a major concern. Comparatively, your grades in Germany, while you are doing your Studienkollege and you are taking those exams, there your grades will be significant. So Shailaja Salugu writes, okay. Thank you for giving information. Okay, you're welcome, Shailaja. Beji Untamed writes, he thanks me for the information. I welcome you. What happens after getting temporary medical license and how to proceed on to get permanent license, and how difficult will be the approbation exam? See, you know already that you have to first get temporary medical license, then proceed for permanent medical license. The exams, the difficulty level of the exams depends upon the state to state and also upon candidate to candidate. Candidate who is, there are researches suppose I have read a couple of weeks back, there was some research that in some particular Bundesland, some state, why do so many candidates fail? Why is the success rate only 33% or say 40%? Then they said the reason that they found out is that students are not good prepared. They just have the certificate that B1, but they don't know the language, or B2, or they don't know the language. They think that exam is just communication exam, just come prepared for say hi, hello, thank you, good night, and how are you feeling, like that kind of questions. But they are not prepared with the in-depth German medical terminology, or the like say Aufklärung. If you have to, Aufklärung is consent. You have to explain the person. If you have to do some say Magenspiegelung, that is gastroscopy, you have to explain the patient that what will be the procedure, what are the complications, why it is necessary for him, and what happens if he does not do that. And then if the patient has more questions to that, the doctor should be able to answer those questions, all of it in German. So if the doctor is not good prepared for these kind of questions, then he is not going to pass. That is why I say that difficulty level depends upon candidates mostly, because they have to prepare well for that exam. If they're well prepared, then people can pass the exam. It's not that people have not been doing it. People have been doing it successfully, some in first attempt, some in multiple attempts. So the next one is a comment on my pronunciation. It's okay, I take that positively. I shall try to improve my pronunciation. As the name of the commenter, the viewer is Eric Autist, I take it as arrogant, ignorant autist, so it does not matter what I say to you. It's okay, fine. Then Faisal Akhtar writes, Mr. Deepak, would you please tell me about the job for physiotherapist and salary structure there in Germany? Yes, very good question, Mr. Faisal. Actually, I am working on the prospects of physiotherapists, nursing professionals and dentists, and I shall come up with new information and new pathways for these professions very soon. So just keep watching my videos. I will get to you soon. Manu Verma writes, I'm MBBS graduate looking for post-graduation courses in Germany. Please help me out. Manu Verma, you are at the right platform. This entire channel is dedicated to post-graduation training in Germany, especially for Indian doctors. So go through the videos. And also there is a website coming up. I will post the links soon. Harihar Sudhan writes, Sir, I completed MBBS in India. I want to work in Germany. Which is better, whether to study PG in India or do residency in Germany? Because as you mentioned in one video, doing PG in India is not recognized in Germany. Yes, exactly. That is why. If your aim is to go to Germany, then why do you want to do PG in India first? Because PG in India is not, first of all, you have to clear those exams, the NEET exams. If you clear that exam, if you are at the top, you have to get in your specialty of choice. So then you do 3 years of that training. And then you start learning the language and doing all the procedure like MBBS graduate does. So if your view is clear, if you want to go to the developed world, or if you want to go to, specifically if you want to come to Germany, then it makes sense that you start with the process sooner rather than completing the post-graduation in India. But if you are not sure, then obviously you study for NEET exams and you take a PG seat in India. So I shall take more questions in the next video. Keep watching. Take care. Bye-bye.